Healthcare costs are one of the top financial burdens for individuals and families today. In the last few decades, the number of uninsured Americans has soared. From 1940 to 1970, there was a steady decline from 75% uninsured to 20%. From 1980 to 2010, there was a steady incline from almost 18% uninsured to almost 30% in 2010. Health insurance, as defined by the United States Census Bureau, is private or government health coverage. Private coverage is insured through your employer, a union, or purchased individually. Government coverage are plans through Medicare, Medicaid, the military, or state programs. According to the Social Problems textbook, in 2009, 17% of households were uninsured. That same year, 26% of households making less than $25,000 a year were not insured. Uninsured individuals and families incur higher costs than those insured because of high medical bills and fees. Some make the argument these people in return have poor health. They usually do not get regular checkups, avoid medical treatment until they've become sick, and sometimes end up in the hospital. Inequalities in class and race often have a great impact on a person's coverage. According to the United States Census Bureau, on average in 2011 and 2012, families making $75,000 or more only had a 6.6 uninsured rate. For families making less than $25,000 a year, 27% were uninsured. Not only does income have an impact, but race too. Those same years, 11% of whites were uninsured, 19% of African Americans, and a startling 30% of Hispanics were uninsured. Even insured families face difficulties when it comes to health insurance coverage. The Social Issues textbook states insured individuals, on average, can only pay about 12% of their hospital bills. Even families with incomes 400% over the poverty line can only pay about 37% of their hospital bills in full. The Agency for Healthcare Research and Quality reported in 2010 that 1 in 3 adults report not having access to specialists in healthcare is a serious problem for them. And in 2011, the same agency reported that 1 in 5 Americans have no usual source of medical care, like a primary physician. Fortunately for all uninsured Americans, and even those who are insured but are taken advantage of by companies, the Patient Protection and Affordable Care Act in 2009 was passed. Although this program's full effects have not been seen as it faces political scrutiny and its various policies are being challenged, the magnitude of what it can do can benefit millions. According to the organization Stand Up for Healthcare, some of the main benefits of this new act are supposed to create are ensuring affordable health care and coverage for every American, regulating new healthcare marketplace, helping small businesses provide health care who couldn't before, improving Medicare and Medicaid, prohibiting denials based on pre-existing conditions, limiting out-of-pocket costs, and investing in preventative care like checkups. One of the other many great benefits given to young adults is the ability to stay on a parent's health insurance until the age of 26. A large stride in health reform will begin January 1st, 2014. Millions of previously non-eligible Americans will be eligible for Medicaid this January. Basically, when completing your 2014 taxes, if you have not found coverage through the government or privately, you will owe a fee. Starting in 2015, the fee will increase every year for not having health insurance. The exception is for families or individuals with extremely low incomes that are able to be granted a waiver. If someone without health insurance incurs medical bills like at a hospital, starting in 2014, the majority of individuals and families will be responsible for 100% of their bills, unlike in the past, where they would work with you, which puts any uninsured person at a greater risk for financial problems like declaring bankruptcy and high tax fees. Because these new laws, Medicaid enrollment is expected to increase up to 26 million new people by 2020, as estimated by the Department of Health and Human Services. Also, with the majority of the population being insured by then, assumed, between 2015 and 2021, healthcare spending is projected to grow 6% every year, which will increase health, preventative care, and lifespan. Now, this is the same graph from before, but it's estimated in 2020 it'll be a little under 10% if things go the way that is predicted. Politicians and organizations are fighting against the healthcare reform that could benefit many families in need of assistance. The true effects will only be seen in upcoming years, but hopefully all families and individuals will be able to be insured under the new Affordable Care Act. Thank you.